breathing is the most important. I mean, it's essential to life, and you're a part of that. You're a part of helping someone breathe.
Respiratory is a very unknown career compared to other things like nursing.
We have a major impact on somebody who's having potentially the worst day of their life.
People come to you, they can't breathe. It's your skills that mean between life and death for someone.
A good 80% of my job is handling patients who are on life support, so on a ventilator. Those really critical patients that aren't able to breathe on their own, I'm helping breathe for them.
If a patient comes in short of breath, the doctors a lot of times will look at us and kind of tell us to fix it. We'll run the blood gases here and report those to the physicians, make ventilator changes.
Also administer breathing treatments, help with airway clearance, like the BESS therapy, different types of chest physiotherapy to help patients clear secretions, manage different types of airways like endotracheal tubes, trach tubes, really a wide range of things, just all do with breathing.
And doctors and nurses come to us and they have questions and they rely on us a lot. A lot of times they will send you in there and you assess the patient and you recommend what goes on with that patient. I mean, so you're a very important part of that person's life process.
Respiratory, at least in Oklahoma, requires an associate's degree minimally to be able to be a respiratory therapist. The respiratory program itself is about 2 years, but total schooling took about 3 years. I worked for about a year as a student until I graduated the program, and then I was able to basically right after I graduated start in the ICU, which was really nice.
Starting out, I worked under provisional licensure as a student doing routine floor therapy care, and I went all the way from that to getting my degree, to getting my certificate, and then getting registered.
And we have a certain number of credits every couple of years that we have to complete. So we're always learning new things, new types of equipment.
I did get my adult critical care specialist test out of the way. And when I did that, they did reimburse me for the test. And also that came with the pay increase.
Ascension St. John does a lot within the community. I'm a part of the community, so that is everything. The benefit of seeing people go home and live a happy, normal life.
What I like the most about working here is our autonomy as respiratory therapists. So we have a lot to say in how the ventilator is managed, what type of therapy is appropriate for the patient. We are very, very involved.
I would say my absolute favorite thing about my job is when a baby who's been in our NICU for 100 days is discharged and going home on no support.
There are a lot of sad situations, unfortunately, that I do deal with, but being able to be there for families during those hard times is very rewarding.
When someone needs to be pulled off of a ventilator or, put on comfort measures, or people say pulling the plug on a patient, we're the ones who do that. We're the only ones in this hospital that will take somebody off life support. That's something that's not lost on us, the responsibility of being the ones doing that. And in a weird way, it's a privilege to be the ones in the room with the families that are grieving.
You have to be a psychologist or a sociologist at times. It's very rewarding. This is part of healing the community.
Patience is important. Being able to multitask and prioritize where you're needed most, because you're going to be pulled in a lot of different directions.
There's times where you have to make decisions pretty quick and you have seconds to make them. So critical thinking skills, a must.
When I was still trying to figure out what I wanted to be when I grew up, I really just wanted to do something where I was helping people. I finally found respiratory and finally found that's how I wanted to help people.
It's almost a skill to learn how to behave in those situations and be there for someone in the best way.
The patient relies on your cue. If you go in a panic, they're going to be panicked. So as a respiratory therapist, you've seen this before. And you know that they're scared and they're looking to you for help. So you do the best you can to provide that.
Also, knowing when to call for help is very important.
It's very rewarding financially and emotionally. Tulsa is pretty much a small city, and you see people in stores or around town and, hey, I remember you helped me get through this tough situation.
My goal in the future for myself, I could see myself in management later on down the line. I think I would like to do some sort of teaching.
This job is going to change you in ways that you didn't really expect. You're going to have very good days and very bad days. But in the end, you're going to make a difference.